This table shows 10 simple rules for the identification of benign and malignant tumors. For the benign tumor, there are 5 rules, and for the malignant tumor, there are 5 rules as well. So it both becomes 10 rules. So these rules applicable on the ultrasound imaging. So first we will discuss about the malignant rule. So M1, the rule number 1 is if the mass is irregular and if it is solid tumor, so this would be considered as malignant. In the second M2, while there is ascites, if it is associated with the ascites, so this would likely be a malignant mass. M3 rule is at least 4 papillary structures within the cystic lesion. If it is cystic lesion or if there is solid, so they should contain at least 4 papillary structure within that. Rule number 4 or M4 is irregular multilocular solid tumor with largest diameter more than 100 mm or 10 centimeter. If it is irregular and if it is multiloculated and if it is solid with a cystic components within it, or if it is cystic with a solid nodule in it and it is more than 10 centimeter, this would also be considered as malignant tumor. Rule number 5, M5, very strong blood flow on Doppler imaging. So these are the 5 M which is applicable for the malignant potential. So always keep these 5 rules in mind while you are scanning. So these tumors must be malignant. For the benign tumors, the same 5 rule can be applied. Rule 1 or B1 is unilocular. If it is cystic lesion, so and it is unilocular, so this would be benign tumor. For B2, if there is presence of solid components where the largest solid component has a largest diameter less than 7 mm, would be considered as benign. Many a time we consider that if there is intramural nodule, so we straight away think there may be chance of malignancy. So far the rule is concerned, if it is less than 7 mm, most likely it would be a benign tumor. For the B3, presence of aquastic shadowing. If there is aquastic shadowing, so this is mostly in benign case. B4 rule is when smooth multilocular tumor with largest diameter less than 100 mm. So if it is multilocular tumor and the largest diameter is up to even 100 mm or 10 centimeter, still this cyst would be benign cystic lesion or benign tumor. Rule number 5 is when there is no blood flow on the Doppler imaging. Blood flow is a very significant indicator of malignancy. If there is no blood flow, it means that the cystic lesion or benign or whatever solid lesion is benign. So these were 10 rules, 5 for the malignant tumors and 5 for the benign tumor. Just have a look, and while you are practicing and doing ultrasonography, keep in mind these are very common rule. Every day you will come across all these points, and it will help you to differentiate between the malignant tumors and the solid tumors or cystic tumors or benign tumors. So that is the criteria for differentiating between the benign and the malignant lesions.